Doctor, what's the cause of death of Michael Cochran, according to your review of the records?
Well, I'm not a cause of death expert since I'm an endocrinologist. My expertise is in hypoglycemia, but it appears that his death was related to hypoglycemia, which then produced cerebral edema.
And that's what I'd ask you, if you feel competent to do so. Can you explain what cerebral edema is?
I'm sorry, could you repeat the question? I didn't hear you well.
Sure. Can you explain to us what cerebral edema is?
Certainly. Cerebral edema is swelling of the brain cells, and that is usually caused by either not enough blood sugar going to the brain cells or not enough oxygen going to the brain cells.
In your report, you indicate a number of, for lack of a better word, pieces of information or tests that could have been performed at one point or another that would have helped you be more definitive in your assessment of the case. Could you explain to me what you meant by that?
Yes. When a person presents with a very low blood sugar, which we call hypoglycemia, there are very specific tests that should be done prior to the treatment of the low blood sugar. There are a list of tests. I can tell you each one specifically if you'd like.
Please.
But unfortunately, you would like me to? Okay. We do an insulin level, a C-peptide level, a pro-insulin level, a beta-hydroxybutyrate, a malignite sulfonylurea screen. And those tests help us determine whether the low blood sugar was related to insulin or not, and where the insulin could have come from. The test needs to be done prior to the treatment of the low blood sugar.
In this case,
unfortunately, in this case, the tests were not performed. I can tell you that I've reviewed many cases, as I told you, of my prior experience, and it is close to zero in any of those cases that the tests were performed. And it's unfortunate because it really helps make a determination about the cause of the low blood sugar.
Okay, so there was a limit, as the state understands your testimony, doctor, there was a limited time during which those tests that you mentioned could have been performed that would have helped definitively determine the insulin issue.
That's right. The test should have been performed on arrival at the emergency room when the other blood tests were performed, or as soon as it became evident that the blood sugar was extremely low.
And what's the impact of treatment? Had the treatment taken place and then those tests performed, what would have been the relationship between those two factors?
What happens is the treatment of low blood sugar is glucose or sugar. And when sugar is administered, it changes the results of some of the blood tests that we draw and makes them unhelpful.
Okay, so those tests were not performed. So what alternative means is there to determine the outcome or the impact of insulin or lack thereof?
In my prior experience with the other cases, and again in this case, the only thing left to do is to go through all the possible causes of low blood sugar and determine if they are credible or possible in this case.
And how many of them would there be?
There are many. I listed, I believe, 13. I left some possible causes out because they don't apply in adults, or because it was very clear from the history of this particular person that the causes would not apply, and I listed 13 causes.
Let's talk about those 13 causes, doctor. Let's go through them, please, and your process of discussing them and ruling them in or out as a potential cause.
Of course. Okay. So the first one I listed, and it's in no particular order. but I'll just go through the way I listed them 2 years ago. That many patients who have diabetes are treated with medications that cause low blood sugar, and that's what we see most often. But the person we're talking about now did not have diabetes and was not taking any of those meds. End-stage liver failure, we call it hepatic failure, can cause low blood sugar because the liver is a good source of sugar for the body when someone isn't eating. And our patient here did not have any liver problems that would be considered end-stage liver problems. He had a minor abnormality of a couple of tests over many years that were not affecting him. End-stage kidney failure can cause a low blood sugar because the kidney makes blood sugar, oddly enough, and helps control blood sugar when people need it. And his kidney function was excellent. A very severe systemic infection, that means an infection that spreads from where it started into the bloodstream, can cause a low blood sugar, and we have no evidence of that. He didn't have a fever at the time that someone checked his his temperature at home, and he didn't have low blood pressure, which is associated with widely disseminated severe infection. He did receive an antibiotic prior to the test we do to check for systemic infection, but he received only one dose, and that dose would not likely have been enough to make that blood test negative, and it was negative when it was done at the next hospital. Very, very, very severe malnutrition can cause, rarely, but can cause a low blood sugar. But this gentleman was not malnourished. He had a normal body weight. In fact, he was interested in bodybuilding and was muscular. So that would not apply. Excess alcohol can cause it in a certain particular circumstance. It can cause it when someone drinks a lot of alcohol and then doesn't eat. That has to do with how alcohol works in the liver, that it suppresses one way of making sugar but not the other. So if someone drinks a lot and doesn't eat for a few days, we can see low blood sugar. And we don't have evidence of that. We don't have a history of alcohol use. His alcohol level was undetectable, and that's not an issue. An insufficiency of the adrenal gland can cause low blood sugar, rarely in adults, mainly in children, but it can. And we don't have any evidence that this person had a problem with his adrenal. It was working very well. He was on a nasal steroid, which sometimes if used in very high amounts could possibly suppress his adrenal gland, but that wouldn't be operative in him. And those steroids are not strong enough to cause adrenal insufficiency. Sometimes medications unrelated to diabetes can cause low blood sugar, but there are very, very few that are really believable. I made a list of the medicines he said he was taking. One of those on the list I subsequently learned was not what he was taking. He thought he was taking something called enclomiphene, which people may have heard of as a fertility drug. Sometimes it's used in males to help increase testosterone. He thought he was taking that, but he was actually taking letrozole, which is a medicine that is used in breast cancer patients to stop male hormones from converting to female hormones, and downstream that tells the body to make more testosterone. So that doesn't have an effect on blood sugar. He was maybe taking a seizure medicine. It's not clear if he was taking it because that's not associated with blood sugar problems. he was taking pseudoephedrine. If anything, pseudoephedrine would raise the blood sugar, but it doesn't cause low blood sugar. I was taking an asthma medication and some inhaled antihistamine, and again, those do not cause low blood sugar. A malignancy is another cause. Malignancy, that means cancer, is another cause of low blood sugar when it's widely spread and very end stage and not very common. And we had no evidence of that in this healthy young man. There is a tumor of the pancreas. It's called an insulinoma. Oma means tumor, making insulin. And those are rare. I've seen a number of them. They tend to present over time. Someone has complaints over months to years when the blood sugar is found to be low. And they're relatively easy to treat. They don't they're not what we call refractory, meaning hard to treat, where you have to give a lot of sugar to bring the sugar up. So it would be very, very unlikely that he would have had an insulinoma. The next item, number 11, is a very, very rare situation where there's no insulinoma, but the body acts like there is one. And we see this most often in people who have had gastric bypass surgery. And he did not. So that would be highly unlikely. Finally, or not finally, near finally, there is what we call the factitious use of medications that cause low blood sugar, where someone takes them, call for attention, call for help. We don't know why that happens. And they're pills. Those pills rarely, some of them are very weak and don't cause low blood sugar. Some of them are stronger and can cause low blood sugar, but they don't cause a low potassium, which we'll talk about later. And our patient here had a low potassium. Finally, antibodies to insulin can cause a low blood sugar. It's been rarely reported in Caucasians. It's mainly reported in Asian countries and in patients with autoimmune problems. And our patient here did not have autoimmune problems. There was a small amount, or we don't know how much, the urine screen for benzodiazepine, which is a tranquilizer, was found in his urine. Usually when that's found, we need to have a blood test to follow up on how much and what it could be, but that wasn't done. There have been some reports of low blood sugar with that medicine. I looked at them carefully. There was a paper from Iran that said that people who came in with overdose of benzodiazepine had lower sugar than those who had other reasons for symptoms. And interestingly, in that paper, they didn't tell us what the blood sugar was. They didn't say how low the blood sugar was. Another paper by those same authors reporting something similar showed blood sugars in the 80s. And we generally define low blood sugar as less than 55. So I'm not sure if that information is quite believable, and it's not in the mainstream of the list of medicines that cause low blood sugar. Some antibiotics we know can cause low blood sugar. He did not receive any of those that we're aware of.
Doctor, you indicated you had the records from Raleigh General Hospital from his admission on February 6th of 2019. Did you see in there the blood glucose level that Raleigh General's testing detected?
Yes.
What was it?
21.
21. What's the clinical significance of a 21 blood glucose level?
I would call that a profoundly low blood sugar. very, very low, which we rarely see. And it's at the magnitude that we were seeing in the cases that I reviewed in the other two series that I told you about, where it's extremely low. I would say that, for me, it's a big call to attention. What is this about? Why is this sugar so low?
But as you've already indicated, even though that calls your attention to it, it did not at Raleigh General Hospital, and none of the testing that you've suggested was performed.
That's correct.
What is the impact on blood glucose of skipping meals?
I'm sorry, I lost the last part of your question.
What is the impact on blood glucose of skipping meals?
A normal person will not have a low blood sugar if he or she skips a meal. The only time that would happen in a normal person is maybe someone treated with insulin for diabetes or with another medication that causes insulin to be produced for diabetes, and then they don't eat. Yes, we can see a low blood sugar, but a non-diabetic person who doesn't eat will have a normal liver response and produce enough sugar to keep the sugar in the normal range. Our bodies are designed to maintain normal blood sugar, and skipping a meal will not cause a low blood sugar in a normal person.
What's the impact of alcohol abuse on blood glucose?
As I said earlier, when someone has a big binge of alcohol and then doesn't eat, that combination is required to cause low blood sugar. If you have an alcohol binge and eat, it's not going to happen.
Now, you mentioned that you found significance in the potassium level of Mr. Cochran at Raleigh General Hospital. Can you expand on that, please?
Yes. There are very few causes of low potassium. Let's go through them. If someone has severe diarrhea, they can lose potassium. If someone has very significant vomiting, copious, tons of vomiting over and over and over for a long period of time, they can lose potassium. If someone is taking a diuretic that wastes potassium in the urine, they can have a low potassium. If someone has too much cortisol production over a long period of time by a tumor in either the adrenal or the pituitary, they could have low potassium. Or really more the adrenal, not the pituitary. But another cause of low potassium is a high dose of insulin. In fact, for years we were treating high potassium with a combination of insulin and sugar. The reason is insulin drives sugar into the cell, and at the same time, it drives potassium into the cell.